Hi everyone, and welcome to our webinar QOF for Clinicians, where we'll be looking at how you can use Ardens SystmOne to make QOF that little bit easier to manage as part of your everyday consultations, looking at templates, coding, and a few tips to help make sure those QOF opportunities don't slip through the net. I'm Mariette, and I'm joined by my colleague Nathan today. We're both training specialist leads here at Ardens, and we've also got our colleague Hannah on the line as well, who'll be helping with the Q&As today. Now, I just want to confirm today's session is specifically for our SystmOne practices. We held the EMIS version of this one yesterday, so if you are actually an EMIS practice and you've somehow wandered into the wrong room, don't worry, we've got you covered. We'll pop a link to yesterday's session in the chat for you. But for everybody else, you're definitely in the right place, so let's get started. Now, if you've joined our webinars before, you'll be very familiar with the setup, but for those that are new, let's just run through a few quick housekeeping points just to make sure everything runs smoothly. So first of all, this session is being recorded and the recording will be shared with you afterwards. So if you miss anything or you just want to revisit the discussions, you will be able to do so. To ensure that we get a high quality recording, you'll notice that cameras and microphones have been disabled, but we really do encourage your participation. So please feel free to submit your questions at any time using the Q&A feature just along the top of the meeting window. That is a separate button to the chat function. So look out for the little bubble that says Q&A and then just pop your questions in there. This webinar is expected to last around about 45 minutes and we will do our best to stick to that time. And finally, if you do experience any audio issues during the session today, the best fix is usually just to leave the meeting and rejoin. If you could give us just a quick thumbs up if you can hear and see the screen all right, that would be really great. Oh, brilliant. Lovely. So what you will notice through today's session is we will be using a few poll questions throughout the webinar, and that just helps to keep things interactive. No pressure, there's no right or wrong answer, and there definitely won't be any QOF exam at the end of this, but it's just a chance for us to get your thoughts along the way. So let's start with an easy one. Who have we got in the room with us today? So Nathan's launched up that poll on the screen there. So if you could just let us know on the screen what your role is, and that will give us an idea of who we're talking to today. Nathan, can you see who we've got?
Yeah, I can. I'm sorry. Yeah. So 35%. Always going down. 35% nurses, so mainly nurses. Okay. 6% GPs. It's always going up. GPs 11% now. It's changing as I speak. But yeah, majority nurses, administrators as well. So obviously a lot of I guess because it's around the QOF stuff. And then we've got pharmacists and GPs. So that's in that order. Wonderful. Basically. I think we do have some others as well. Sorry, I should scroll down. Okay. Oh, non-clinical other 16%. So there you go. Okay. So yeah. Great.
So a real mixed audience today, which is great, and that's absolutely fine. So the aim of today isn't to go through all of the QOF rules or overwhelm you with lots of codes and numbers. Instead, we're going to look at some practical ways you can use the Ardens resources to help you capture your QOF activity as you go and make sure you're getting credit for the care that is already being provided. Now, we'll look at using the templates to support QOF coding and data capture, completing those annual reviews and using optimistic QOF data capture as well to identify any opportunities to record anything additional for your QOF activities while you're doing your routine consultations. We're also going to share some tips around data quality and avoiding any missed opportunities. But it's important to stress that this session is aimed at anyone involved in clinical care and QOF recording. So whether you are the GPs, nurses, pharmacists, or any other clinicians joining today, or whether you're an administrator, you'll come away with some useful tips that you can put into practice straight away. And for the administrators on the webinar today, hopefully you can take away the learnings from today and share that with your clinicians in your practice. Now, just before we dive into the content, we're going to launch another quick poll, and this one is to get your thoughts around what your biggest challenge is with QOF. So this one is called a word cloud. So if you can pop into the free text box there, what your thoughts are around what your biggest challenge is with QOF. And that will hopefully give us just a bit of an idea as to what issues you are facing. Oh, okay, obesity. Not surprised. Diabetes, blood pressures, lots of changing criteria. Yep. Data. So I'm guessing that's entering the data maybe. Correct. Read codes. Okay, there's some interesting ones there, Nathan.
Yeah, I think hopefully we'll cover a lot of that, and hopefully the templates will make it
Yeah.
easy to understand exactly with regards to like the codes and things like that. So
yeah,
yes.
That gives us a great idea. So thanks, guys. Thanks for filling those ones in. Now, before we get into the detail of what's changed for 26-27, just want to spend a minute on why this actually matters day to day, because QOF can feel like a box ticking exercise, but it really shouldn't be. So firstly, clinics are busy. We all know that appointments are short and the list is long. There's rarely any slack in your day to go back and pick things up. Then there's the complexities. So more and more of our patients aren't just diabetic or just hypertensive. Sometimes they have both, and then they might have CKD and something else and something else. And then each one of those patients carries its own set of requirements. Another challenge is missed coding. So the clinical work often gets done, but it's that coding that slips. And if it isn't coded, as far as QOF is concerned, it didn't happen, which then all generates a whole load of extra admin. So that might be additional recalls, follow-up letters, chasing, data quality work by the admin teams, all work that lands back on the team weeks and weeks later. But here's the thing. Most of the hard work has already happened before the patient even sits down with us. The admin teams have identified who needs to be seen and got them into that clinical room. Our job now is to make the most of the opportunity while we've got them. So how do we do that? Well, firstly, make every contact count. So treat each appointment as a chance to close out everything that's still outstanding, not just the reason that they've booked. Templates are a great help. So our templates are built so that a single consultation you have can satisfy several indicators at once, and it means you can tick off lots and lots of different things at the same time. Make sure you capture everything. So the alerts will flag what's outstanding in real time so that you're not just relying on memory or having to dig through the records to find out what is actually missing. Then there's reducing your follow-up. So one of the key things here is do it once, and if you do it properly, then you're not going to be generating another recall in 3 weeks' time. So really, that's the framing for today. It's less about chasing those points and more about doing the work that you're already doing in a way that gets captured first time. With that in mind, let's look at what has actually changed for 26-27. So there are several new QOF indicators this year, and I'm just going to highlight the areas that are most relevant to clinical teams. So in cardiovascular disease, there are 2 new indicators looking at blood pressure control in patients with coronary heart disease or stroke and TIA. So these are worth a combined 61 points. So blood pressure recording and management in these patient groups is particularly important. There's also a new diabetes indicator, DM37, which looks at completion of the 8 key care processes. So as well as recording the individual care processes, it is important to make sure that these are captured correctly in the clinical record. I must stress as well that this is an all or nothing indicator. So all 8 processes must be completed for the indicator to be achieved for the patient. For heart failure, you'll see there's a new indicator looking at treatment with appropriate medications. And then the other major area of change is that obesity domain. So there are 2 new indicators, OB04, which looks at eligible patients who are referred to weight management within that specified time frame, and then OB05, which looks at the follow-up and ongoing support. So overall, the main message from these new indicators is that good clinical care still needs to be supported with accurate and timely recording. If something hasn't been done but isn't recorded correctly, it may not count towards your QOF achievement. So that's enough about the new indicators. There have been some updates as well. So The updates to the existing indicators will include for asthma, so you'll see that the age range has changed with patients now included from 5 years. For COPD, there has been a denominator change, or there's an update to how the denominator is calculated. So this is intended to improve the accuracy of patients included. So you may notice some changes to your COPD register or achievement as a result of that. For hypertension, patients in the frailty cohort are now excluded from hypertension number 10 and 11. There's also a change to non-diabetic hyperglycemia, with patients who have a history of gestational diabetes now being included. For stroke and TIA, you'll see that a new medication has been added as an option to your antiplatelet treatment indicators. And finally, you'll see that there's also been some updates and changes to thresholds and points. So for AF, your upper achievement threshold for AF06 have actually increased now to 95%. And there's been some changes to the points available for cholesterol and diabetes indicators. You can see all the details on the slide, but the important thing to remember that a change in points doesn't necessarily mean that the clinical requirements have changed. So just have a detailed look at what's expected for those indicators. So when you're reviewing your QOF performance this year, it is worth checking the current indicator requirements and your patient cohorts, and do not rely on how things worked last year, because some things will have changed. And then the last slide for updates. So replaced indicators and childhood vaccinations. Firstly, a number of the indicators have been replaced this year, including the indicators that cover coronary heart disease, diabetes, heart failure, and stroke and TIA. So I won't list them all off. They are on the screen for you there. Finally, some changes to childhood IMS. QOF points and thresholds themselves haven't changed, but it's worth noting that you've got the improvement threshold calculations which have now been added. In simple terms, that really just means that practices can potentially earn additional QOF points by improving the vaccination achievement from the previous year, even if you haven't reached the achievement threshold. But the QOF points and thresholds themselves haven't changed. And also MMRV is now included to count towards QOF. So overall, message from these changes is just that there are quite a few differences in QOF this year. Don't assume that last year's rules or patient lists will necessarily apply this year. When recording your care, make sure that you are familiar with the current requirements and the clinical activity is recorded accurately and in a timely way. Now, just before I hand you over to Nathan, we're going to have one last poll, and this one is about how you are currently capturing all of your data during consultations. So do you already use the Ardens templates? Maybe you're using another in-house template, or maybe you're just recording free coding whilst you're doing your consultations. There's no right or wrong answer here. It's interesting to get your thoughts as to how you're actually capturing that data.
I mean, 95% Ardens template so far, so that's good.
Oh, brilliant.
Oh, it's gone down a bit, 87%, but yeah, majority are using Ardens templates. So a lot of this will be familiar, and hopefully, should hopefully make sense to everybody.
Great stuff. Fab. Well, I'm going to hand you over to Nathan now to go through all of the resources.
Thank you. So I will flip to my screen in a minute, but I think I control your screen from here. So let me we tried this earlier. So I've just clicked. If not, let me click again.
There we go.
There you go. Right. Excellent. So I will share my screen in a minute, but yeah, just wanted to kind of dive into SystmOne. And kind of show you kind of the templates. So what I'm going to do is kind of go over the best practice, like the standard templates that you would probably be using for your reviews and doing your diagnosis for kind of each of the conditions. It's going to focus on a couple of conditions. I appreciate there are lots of different things around QOF and that. So I think it's just important to say that we have been doing specific QOF because these little like mini bite-sized lunch kind of sessions we've been doing. So we did one for heart failure a couple of weeks ago, and we're going to be doing one for kind of each of the different areas. This is kind of like an overview, so I'm not going to be going into kind of every QOF condition and things like that. But to be honest, if you know how one template works, they all work very similarly. So this should hopefully kind of make sense. Now, I think the first thing to say is a lot of the time, most of you are probably accessing the templates different ways. if you're doing a consultation on a patient and they come in and you want to do the reviews, I think the easiest kind of way that you probably know, and I'm just going to click, hopefully it's like go click again. I don't know how this works. There you go, perfect. So I'm going to zoom in. So when you go to the patient demographic box in the top right of SystmOne, we've got the patient open. You have all of those icons under the patient's name. Now, a lot of you are probably doing this already, but it is amazing. I still speak to people and they don't realize they can get to the templates that way. Those icons will be on that specific patient if they have a current diagnosis of something. So the likelihood is when you're doing your consultations, you're doing your review, they're going to be in because they've got that condition and they will have the icon. So as you can see on this patient, you know, they've got a few, but they've got like the blue inhaler under their name. That is because they've got a diagnosis of asthma. The D would be for something like diabetes. I think that little heart with the clock would be heart failure, that sort of thing. Basically, just wanted to say that is the easiest and quickest way of getting to the template I'm about to show you. I don't have a live patient I can show you, so that's why I'm showing you kind of the screenshot. But that's I will show you other ways you can get to specific QOF templates in a minute, but I want to start on the standard templates. So I am going to take control now. I'm just going to go share, and I'm going to share my screen. So let's just say we were doing a consultation and they came in for their asthma. So I would click on the blue inhaler, and if I share my screen, you will get something like this pop up, which allows you to do these consultations. And again, a lot of you might be doing this already. And this is the standard asthma template. It will work out how old the patient is. So if there are nuances with age, etc., it's going to automatically do that. Now, what you've got obviously is the tabs across the top and down the side. All of the QOF codes are embedded on this template, but what you've got to remember is this template also has best practice. It's kind of like the nice guidance, because we should all be doing more than QOF codes. QOF codes are essentially the bare minimum, if you like. So this template has everything on it. We do have specific QOF ones, which I'll show you in a second. So just very quickly, and again, all of our condition templates flow the same way. So if you know how it works for asthma, it'll work for heart failure, any of those things, diabetes, etc. So with regards to that, for any, and again, I know we're talking about doing reviews, but I just want to talk about this template. If the patient didn't have the diagnosis and you brought this template up, we do have the diagnosis page and all of these templates, which will give us the criteria to diagnose that patient. And again, I think most of you know this already, but a red star on any of these templates indicates that is a QOF code. And this is going to give us, yes, best practice, but it's going to give us the criteria and the things that we need to be thinking about to diagnose. So obviously, this is only for, say, GPs, you know, anyone that can diagnose. If I'm doing a review, I wouldn't have to go to this page. So I want to stress that. But if I'm a GP, you know, we've got our codes around, you know, the symptoms suggested of asthma. That's not a QOF code, but that's kind of good practice. But as part of the QOF rules, we would need to be recording that a test has been done to say that this patient has asthma, which is why the red stars are next to all of these things, you know, like the pheno test or, you know, spirometry, etc. And it tells you that, and, you know, and one of the following objective tests as per the NICE algorithm. So ticking one of those is going to get that QOF code to say that that is the test that we did. And then we have the drop down to then record whether it's asthma, and that would then add them to the register. So you can use the Ardens templates to be doing that diagnosis and correctly code it to make sure that they enter the register. You will also notice on this diagnosis page that there is a personalised care adjustment if it's relevant. So with regards to this, maybe that, yeah, we've diagnosed them with asthma, but, you know, we do have the kind of personalised care adjustment for spirometry was not done. Again, don't worry too much because this has other things on. I'll show you the specific QOF templates in a minute where all of that's in one place. So that's just the diagnosis page. But and again, I don't want to spend too long on this because a lot of you might be doing this, but I'm going to go to the review page because actually a lot of the time we're just going to be doing the review. So and all of these review templates, again, like I said, this is best practice, but at the bare minimum, we want to be coding those red stars. And we know that those red stars would be all of the codes that we need for QOF for an asthma review in this case, because we're on the asthma template. But this would be the same across the board for diabetes, for heart failure, any of those things. The red stars are the codes we want to be getting. So again, you know, don't want to teach everyone to suck eggs, but, you know, asthma annual review code, that's the code we need to get. We know we need to do an asthma control test. So again, we can either put the score in there or it is grayed out, but there's a link to actually get the questions up, which would code the asthma control test score. Smoking, again, like kind of Merritt was saying at the start, if we're doing kind of everything in one go, smoking might have already been recorded. What you can do if you have a patient open, if you either click on smoking or in the box, it is going to tell you on the right hand side if that code has already been captured and when. So if I click there, you might have a date of the 1st of March 2026, smoking. That was captured for last QOF year, so then we might need to do it again. But if it was done this year, well, actually, I don't need to code that. It was already asked in an initial appointment or something like that. So just bear in mind, you've always got that option on the right hand side to see if this has already been done. Everything else on here is best practice, nice guidance. Obviously, the inhaler technique has now not got the red star there, but again, it might be something you want to do. We always get, a few of you probably thinking now, what's a yellow star? A yellow star would be like a local enhanced service or something that you might have to do locally. So it might not always be applicable to you, but that might just indicate that, yeah, you should probably do that as well. It's not QOF, but it is linked to, say, another payment. You might see blue stars on some of these templates as well. That's more national code, so like kind of like your IIF things, that sort of thing as well. So usually a star indicates something like a payment and things, but the red stars are your QOF ones. And then we know the only other QOF thing we need to get on this page is the number of exacerbations in the past year. Everything else is what you would do in a normal consultation, best practice, and it would vary from patient to patient. But all of these have the QOF codes on them. And then I don't know if you, again, I mean, this is a separate thing altogether with asthma, but we've now separated the consultation to have 2 pages because there's too much to fit on one. So you've almost got the bit where you have the chat with the patient and you know, do your assessment, and then the management is right from what we've just assessed, this is what we're going to do next. So again, a lot of this is best practice, but we know the QOF codes on here are your medication review code and your care plan. And again, we've got links to kind of like actually print the care plan off or prescribe a certain drug. So again, anything linked to QOF is going to have the red star on it. And it is, you know, if you're getting that done, you're going to be getting your QOF. So that's all very well and good, but you might want to know, well, actually, what are the QOF, you know, what are the QOF rules behind this? I just want to know what the QOF is and nothing else. So with regards to this and a lot of all of these templates, and this is one thing, a lot of people probably know about this, but they don't know about this bit. And we always kind of bang on about it. Again, I'm not in a patient, but you can see, and down here, you've got 2 buttons with stars. Now that one there, that would, get rid of that. That one there would basically be a link to the asthma QOF template. And what that does, it would be a red star basically. And that red star would essentially open up all of the QOF rules for this year and the codes, but nothing else. I wouldn't use that in a consultation per se, but if you want to know what the QOF rules are, or you're an administrator, or you just want to add, you know, understand a bit more about the QOF, then that's a really good link to get to. The one below it, if you're wondering, would be a yellow star, and that is basically for kind of like your local enhanced services, which obviously we're not covering today, but that is a useful link where you can see if there's anything locally that you need to be doing as well. So again, it just kind of like guides you with regards to that. Now, I can't access it from there because I don't have a patient open, but what I can do is I'm just going to come out of this and go a back way, but really you could just click on that red star and that's going to open up the asthma QOF template. Another way to get to that, if you're not from there, would be to use your F12. So if I was to press F12 and type asthma QOF, or just type asthma and click search, then we can access it from there as well. If you type QOF, it's going to bring them all up. So you can get to it. You don't have to go to the asthma kind of best practice template. You can go to it direct as well, but you can access it from the templates. So with that in mind, if I show you what that looks like, you're going to get something like this come up. And again, every condition has this template, and it's a really useful place to go. And what it's doing is it's giving us the QOF rules for this year and look age 16 over, you will notice there is a tab at the top for age 5 to 16 as well. So you've got the two variations there if there is a variation. You will also notice there's a tab for last year's rules. So if you wanted to compare what's changed from last year to this year, I could click on that and you've got what the indicators were called and what the rules were last year. So really good way that you can see if anything's changed. Again, like Marit was saying, there's been changes, there's new things, etc. But if I go back to this one, and then what you can see here is, well, the first thing we've got is what codes add them to the asthma register. And we've got a link to code the asthma diagnosis codes and the asthma related treatment codes. Again, if the patient's already on the register, you don't need to add it again, but it's just if you want to know what the codes are, etc., you have the ability to do it there as well. And then we're basically telling you, okay, AST 015 indicator, what does that indicator mean? It's a review and care plan on the same day with exacerbations within 1 month before. So straight away, we know what we need to be coding, because sometimes like for this, the exacerbation can be recorded within 1 month before, but the review and the care plan has to be done on the same day. And again, most of you know that, but if you think of it for this, it would be the same across the board. And these drop downs have all of those codes in to capture it. But like I said, those codes are on the other template anyway, so you don't need to come here and code it here. This is just getting rid of all the other noise and just telling you what the codes are. And again, like I said, if you click on these on the right hand side, you'd be able to see when was that review last done. Click on care plan, when was the care plan done, has the exacerbation. So if things are missing, this is another good place to come to see actually if they've done the review and the care plan, but when I click exacerbations, that's not been coded yet. So again, it's a good place, and then we could maybe do some data quality stuff and backdate, etc. So again, just a useful thing. And again, here's the asthma control test codes. So you've got your asthma control test or childhood asthma control test and inhaler technique as well. So, and this is a bit of a weird one this year because the asthma control test and inhaler technique are mentioned in the description for QOF, but they're currently not included in the extraction rules. So again, it's telling me, it's informing me of that information. And then, so it might be that, well, we should probably be doing that anyway. So obviously we are just going off what QOF and what the rules are. We're just interpreting it and trying to present it to you in an easy, digestible way. And here's our, around tests on diagnosis. So that was that diagnosis thing, which was on that diagnosis page. Again, we've got the various codes. It can be any of these tests are the codes you need to be coding to make sure that that indicator is captured as well. Now, the other good thing about these pages is you have the personalized care adjustment codes as well. So if there's anything that can't be done or we want to exempt them, we can't exempt them, that's the old word for it, but add a personalized care adjustment, we have all of those codes that are relevant for that. Now, I see a lot on our Facebook page sometimes in various support queries, a lot of people come to us go, well, I just don't know what the code is that I need to add for a personalized care adjustment for this condition. If you go to this template, it will tell you. So this has all the codes. If you're wondering what codes you need to capture QOF, use this template because it's a really good place to go. So I'm hoping that kind of makes sense, and it's a really good kind of guide. You'll also notice, again, it is grayed out, but where you've got your personalised care adjustment, there is a button to access the QOF rule set, and that would open up the national guidance and all the PDFs and everything if you want to do some further research. So you have got that link there as well to save you having to find it and Googling it and things like that. So again, just a really useful template. And if I just show you the same thing for, I don't know, something like heart failure, again, you would go to the heart failure button under the patient's name in the top right. I am just going to have to, I am going in the back end here. So, but hopefully you understand what I mean. So we've got the conditions, general, best practice template, heart failure, exactly the same as that standard asthma one. We've got the diagnosis page. And again, the red stars linked to the QOF codes, but everything else you would do. And then we've got our diagnosis pages. So for like an assessment. So again, we know that the heart failure annual review and the New York Heart Association classification codes are there. And if we go to the review plan, we know the heart failure medication review code is on there as well. So we know those are the QOF things, but there's loads of other things we would do. And again, you do have a link on all of these pages. You've got that red star, which will be red when you're in a patient record, and that would open up just the QOF rules and nothing else. So essentially use this for your consultations, access the QOF one, which I'll go via here, access the QOF template if you just need to see the QOF rules. And again, can you see how it's the same as the asthma one, but for heart failure? So you've got the codes that get them on the registers. And in this one, it's slightly different. For heart failure, there's nuances around, yes, you can have heart failure. Not every patient with heart failure is going to have a reduced ejection fraction code as well. So there's two separate registers for that. And that would, adding it there or on the template, would get them on that register. And again, it just talks us through, what the indicators are. Now, the reason I wanted to show this one was with regards to something like this, and it would apply for all the other things like diabetes and your key care processes and all of those things. Well, for that, you can't exempt those. But for this, you've got all the different codes for those in, where an indicator needs more than one code, they're going to be on there. And with example for this, it's telling me that, the patients need to be on any of those 3 drugs plus a beta blocker plus MRA plus a SGLT2 inhibitor. So, and again, we've got the codes on this one. So for this one, let's just say they had all of those medications, but they can't have an ACE inhibitor. There is the declined and contraindicated codes on there as well, so these are the codes that would affect QOF, because it might be in that case, for something like this, they can't have all of them, but I don't want to not achieve my QOF. So where that's applicable, then you can put the codes in there. Obviously, like Marriott said at the start, for your diabetes key care processes, they all have to be done, and you can't do that for those, which is slightly annoying for a lot of you. And I know that's, again, we get a lot of queries of people saying, oh, I've done everything, but I can't do that indicate. If at the moment, there is no way that you can say, I haven't done that bit, but done all the others. But for something like this, there is the ability to say they've declined or it's contraindicated. So again, it's giving you those rules and helping you. And again, at the bottom, there's the standard personalized care adjustment for the whole kind of heart failure kind of cluster of codes. So all of those will help you. Now, it's worth knowing as well, there is a standard QOF template, which has all of this in one place. So yes, you can get to it from those. But again, if I was to just go F12 and search for QOF, there is literally one called QOF. And I think it's on there it is there. And that has all of these in one place. So you might want to have this as a favorite. And if I show you what I mean, again, it will be grayed out, but it will hopefully make sense. So if you were to access that QOF template, it has one page which shows you any missing work, etc. for that patient. And on the right hand side, you've got links to all of those QOF templates direct if you need to get to them, which again is quite useful. But it's the same what I showed you, asthma's there, etc. But the other good thing about this is you've got your tabs across the top. So if you go to the QOF registers, it's going to tell you what the codes are to get them on all of those registers. So just the actual code, the QOF register codes for asthma, atrial fibrillation, blood pressure, cervical screen, all of those. So again, yes, they're on the other templates, but if you just want to know what they are, it's all in one place. And then one which is really useful at the end of the year, the personalized care adjustments tab will basically have all of the different personalized care adjustments in one screen rather than you having to go into each separate template. So if you've got a patient that can't be achieved for a lot of these because they've got a lot, you'll be able to see what they've got here in this view, all of the different personalized care adjustment codes for each condition are on those drop downs. So again, just another useful tool that you could use for doing that. I'm running out of time. I always do this. One other thing before I just dive into Ardens Manager, don't forget you've got your long-term condition template as well. And I'm going into like individual conditions here. But we do have the long-term condition templates. Now we have separate training on this and we will talk about that at the end to kind of get that booked in. It's just more food for thought really. But when it comes to kind of doing a long-term condition review, you can use the long-term condition review to kind of do everything in one go. And I'm just going to show you very quickly kind of one of them. So if I just show you like the CVRM one, because again, it's quite hard to demo this without a patient. And again, the long-term condition templates, what you can do here is I can collate everything into one go, and this will be bespoke for the patient. So if I was a clinician, I could bring up the long-term condition review template, and what it's going to do is it's going to tell me all the different areas, and these chevrons will only be next to the areas where I have to record information. And the idea is I could do everything in one go. So it will only let you go to the tabs that are relevant for the patient. And And wherever I go, I could go to this and it's going to have where I could do like an assessment, but the red stars are on there as well. I don't want to go into too much detail of this because this is a whole separate session and we do webinars on the long-term condition process. So that's why I'm purposely being a bit, quick on this one. I just wanted to let you know that if you do it as part of the long-term condition process, those QOF codes are on that kind of collated one-stop shop template as well, and that would capture all of your QOF in one go. And like Marit said at the start, you're doing everything with the patient and you're filling in all the boxes everywhere, so you don't have to do everything twice. As I say, we'll give you information about that at the end with regards to further training and the webinars that we've done on that. I think we're doing a webinar every couple of months on the long-term condition process anyway, so but just don't forget you can do it on there as well. Going to dive in to Ardens Manager. In fact, no, I will very quickly show you. So very quickly, actually, just some useful reports that you can use as well. So if I go up to reporting and clinical reporting, again, I don't want to spend 8 because we've done separate sessions on specific QOF stuff. But when you go to your clinical reporting screen, you'll be very familiar with this. You'll have my reports, local reports, but you'll all have access to the Ardens Limited folder. Now in here, if you go, we have a folder called Contracts 2026-27 QOF. And I just wanted to show you in here, we've got a load of case finder reports. And because this is for clinicians, this is why we're kind of focused on this. So all of these reports, again, you might know about these already, we have built them to basically say, well, currently these patients are not on your QOF registers, but something's going on that might mean that you want to add them to it. So with asthma as my example, this one here is basically saying, okay, query asthma. So they don't currently have a diagnosis of asthma, but they have a history of exacerbation, of an exacerbation code, a review code, or a plan, and they've had an inhaler issued to them in the last year. So if you were to run that report, you'd be able to see a list of patients, go, well, why have they currently not, they're not currently on the asthma register, but they've had these things done, what's going on? And you'd be able to dive in and work that out and then essentially decide if you need to re-add that asthma code to make sure you're getting paid for them and they're getting their reviews done. So it's the same across the board. Again, I'm using asthma as my example, but it could be for any of those things. Patients who have an HbA1c of above 48 currently don't have a diagnosis of diabetes. So loads of stuff there that will help you with regards to getting patients that currently are on your registers. This is also in Ardens Manager. So what I'm going to do now is just show you some of the dashboards in Ardens Manager and how that can kind of help you with this as well. So I'm very conscious of time. So if I go to my, that always happens. So let me just move that out of the way. So let me go to my Ardens Manager. So again, those of you that can log into Ardens Manager, you're going to be logging with your smart card. So just bear with me because it always does this when I just timed itself out. So I'm just going to put my smart card pin in. And I just want to quickly show you the QOF dashboard and how this can help you as well with regards to looking at the data in a different way from that you've inputted. So just wait for this to load. So when you get into your Ardens Manager dashboard, the quickest way that I would kind of get to your dashboard, you can get to it on the side by going to contracts, but I've got absolutely loads on there, but you should have your QOF dashboard on there, but you've got this little search box at the top. So if I click in there and type QOF, I've got QOF 2627, click on that and it's going to launch my QOF dashboard. And this was updated straight away before all the other rules were updated in System 1. So this was kind of a really good way of checking that before it was done in System 1. And you kind of get an overview of how you're doing as a practice with regards to points. But just because I was talking about respiratory, you can see you've got your different QOF areas across the top. If I click on respiratory, it's going to give me how my practice is doing. So currently my practice have achieved 0 out of 44 points. So we're not doing very well, but you'll be able to see how you're doing and it would be kind of gold on these little kind of graphs with regards to that. And then if I scroll down, I've got all my indicators. So my objective test within 3 months before, 3 months after diagnosis, or review done in the last 12 months. So you've got all of that data on there. And then what you can basically do is you'll be able to dive into this and actually have a look to see who's had the reviews, etc. The bars here will obviously show you upper and the lower and upper thresholds. and how we're doing. So again, this is dummy data, but we've only achieved 0.65%. We want to be getting to 45% for our minimum. We've achieved 0 points. Well, that makes sense. We haven't even got minimum yet. We've done 1 patient out of 153 in total. And what you've got here, which is quite useful, you've got your remaining to achieve your points. So currently we've only we need 20 points to get to maximum payment. That is 107 patients. And you'll notice that's different from 152, which is your total number of patients. Essentially, it's 107 patients until you get your full payment, 152 to get 100%. You can change that there to minimum. So we know we've got 68 patients there that we need to get our minimum payment. So again, it's quite a good way of kind of focusing your work and seeing where you could achieve first and that sort of thing. But if I go into this one, so let's go into this one. So reviews done in the last 12 months. If I click view, it's going to open up that dashboard. And I know I've only achieved 1 out of 153 patients. And I can see how I'm doing against everyone else, which is not very good. But if I click the patients tab here, I should be able to see all of the patients that would fall into that indicator. But you'll notice they will say to do. So I might want to know who's the patient that I've actually had that review done. So here it says show achieved and remaining. I can go to show achieved only, and it's going to pull up. So Erica has had it done. I can click on the drop down and go to show remaining, and it's now going to show me all of those patients that I need to get in to have their review done. Now, what I can do is, while you're here, you can also look at the patient view. So if I was to click view on this patient here, it's going to load a view of that patient, and I would be able to see what else needs to be done. So this is kind of like here's the patient's name, date of birth, NHS number. We can see kind of QRIS scores, etc. up here. But what I can do is if I click on the contracts tab, I can see all of the other QOF areas that this patient has outstanding. So not only do they need to do a review for asthma, we need to do a CPD review, we've got hypertension, they need to have one of the vaccinations, etc. So we can see all of the other areas that they might need to do, and then I could go, right, well, I've got this patient, I can go and do this and do that. And you even have a link to the different dashboards if you want to view them from there as well. I'm sorry, I'm being, right. And you also, mine says open in EMIS. I know this is SystmOne session. Up there, you have the ability to open that patient in SystmOne as well, and see, open the record and do whatever you need to do in there. So you can use that to kind of see if they've got anything else outstanding as well as the asthma. And then just one last thing I wanted to do, if I go back to the respiratory dashboard, is the case finders are in here as well. So again, we're still on the respiratory dashboard. So there's all the review stuff. But down here, we've got our case finders. Now, for example, there's that one I was talking about earlier, the asthma. They don't currently have a diagnosis of asthma, but they've got asthma or exacerbation review plan and an inhaler. So I've got 4 patients. If I click view, I'd be able to see who these patients are again. Go to patients, and I can see their names on there. Now, what I can do here is you can do the check patient. Now, I did try this before, so it was working. So this is another little feature. If you click this question mark, we can work out why this patient's on this report and investigate further, because they currently don't have that diagnosis of asthma. It's like, why? So if I click this, it's going to tell me that they're in the report. So give it a second to load. And it's basically telling me that the patient's in this asthma. So there you go. They are in this asthma history of. So if I click this link, it's going to give me a bit more information. And what it's going to do is, if I open up these, it's basically going to tell me why that patient's on that report. So we know that they're not in the asthma register. That's good. That's why all that's felt, because it says if any of the following criteria are true, then exclude. If not, then next rule. So we know they're not in the asthma registers, but down here, it's telling me that they've had 2 codes of history of asthma added to them, one on the 16th of April 2026 and one on the 23rd of March. They've also had some inhalers issued to them as well in the last year. So straight away, I can look at that and go, well, that's a bit weird. And I know the dates, and I would then be able to go back into the patient record in SystmOne, look to see what happened on those dates, and then do some further work and potentially add the asthma code if I deem it's clinically relevant they've got asthma. So you can use this and dive into the data in a bit easier way and use that for your case finders as well. I better stop because I'm running out of time, aren't I, Marit? So shall I hand over to you? Yeah, sorry.
Yeah, sure. Lovely. Thank you very much, Nathan. And hopefully for everyone on the webinar today, that's given you some real insight as to how you can use all of our resources. So just to finish off, there are a few things to take away from today. Firstly, take some time to reflect on what we've covered and have a look through to all of the relevant support articles if you need more information or any guidance. You can also review those short webinars we did recently where we explored a couple of indicators in detail. So as Nathan mentioned, the most recent ones we've got is obesity and heart failure. It's also important to make sure that all of the clinicians involved in QOF-related patient care have received the appropriate training so that everybody is working from the same understanding of requirements. And finally, it's a good opportunity to do some housekeeping of templates. Make sure that you're using the Ardens templates and that any in-house or self-made templates are reviewed or removed where appropriate, because those small steps can really help make sure that you are well prepared for the QOF year ahead. Now, before we finish, just want to quickly run through the support that's available to you, because hopefully you won't feel like you're on your own with all of this after today's webinar. If your practice would benefit from some additional training, you can get in touch with our training team using the email address on the screen. This is great for individual practice sessions, and you can ask us to cover whatever topic would be most useful for your team. For any issues or problems, our lovely support team are there to help you as well, and we've linked all of the QOF support articles on this slide so you can easily find them afterwards. I have also popped them in the Q&A section for you there. I would also recommend having a look at our webinars page. If today's session has made you realise that you need to go back to QOF basics, we've got a recording for you of our QOF for Beginners webinar that we did. Or if you want to go a little bit more deeper into the particular areas, you can sign up for the other QOF webinars that we've got coming up over the course of the year. We've also got those QOF Spotlight series that I mentioned where we look into each domain, so do have a look for the obesity and heart failure ones, and there's plenty of other things that you can dip into in there. And finally, don't forget about Ardens Academy. This is our self-learning platform and it's available to all the staff in your practice completely free of charge. Everyone can create their own individual account and track their progress through the different courses on there. And I have popped a link in the Q&A for that one as well. All of those courses, there's lots of them. They cover so many different areas. It's not just for clinicians and it's not just QOF, but also it's worth noting that some of those courses even have CPD points attached to them. So there's lots of ways to get some extra help if you need it, whether that's a bit of one-to-one practice training or just a quick answer from support. We've got everything there to have you covered. And that does bring us to the end of today's session. So thank you all so much for joining us. Before you head off, we'd really appreciate it if you could take a couple of minutes just to complete the feedback form using the link on the screen. Your feedback helps us to understand what's useful and what we can improve for any of our future webinars. So hopefully you've picked up a few useful tips today that you can take away and use in your everyday consultations. Thank you again for joining us and enjoy the rest of your day.